Good afternoon. Over the last few weeks, Adams County has witnessed an exponential growth in COVID-19. This has led to almost 1,000 cases in our county, active cases in our county, 70 of our residents hospitalized, and the overall medical capacity of our region dipping to dangerous levels. This trend cannot continue, and the leadership team at the City of Quincy and Adams County have been working to slow the spread of this disease. We've discussed many approaches to accomplish this objective, including a proactive pilot program to employ mass rapid testing and contact tracing in Adams and Brown counties. The goal is to identify as many residents as we can who are carrying the virus, isolate those individuals so they are healthy and safe from spreading the virus unknowingly, to begin contact tracing immediately so we can contain spreading, and to follow up with patients who are carrying the virus to give healthcare options earlier in their diagnosis. The plan will utilize a multi-pronged strategy which includes a mass drive-through rapid testing facility, 2, a drive-up rapid testing mobile operation where we go into the villages in Adams County and Brown County and offer a drive-up testing resource. 3rd, an employer-based rapid testing program. And 4, an outbreak and crisis response. We are extremely excited to announce that last night, IDPH Director Dr. Ezike approved our pilot program, and we will begin our operations on Monday. This will take an unprecedented amount of coordination between our health department and the state to ensure that we have the amount of rapid testing kits that we need. It will also take the City of Quincy and Adams County redeploying personnel over the next few weeks to provide the staffing needed to man the testing sites, perform the test, enter data, and contact trace. To that end, I have issued a state of emergency beginning tonight at 5 p.m. for the sole purpose of redeveloping city resources and personnel. On Monday, the City Council will be asked to extend the state of emergency until December the 7th. So we are clear, the state of emergency will only give us the ability to redeploy resources and will not have the ability to empower any other measures. The Adams County Rapid Detection and Isolation Plan has the potential to give us a way out of mitigations, to keep people from unknowingly spreading the virus, and to show to the state of Illinois that Quincy and Adams County can lead the way in a medically based method to combat COVID-19. To do this, we are asking, first, beginning on Monday, for area employers who had employees working remotely in the late spring but are now back in the office to return those employees to a remote setting. Let's get as many people at home as we can. 2, we'd like for interested area employers to reach out to schedule our on-site testing. 3rd, we want and we need our residents to utilize our testing site. This is a free, rapid test and will give you the peace of mind that you are not bringing the virus to a loved one's house or to your workplace. We also ask for your patience. This is a new pilot program that our community is trying for the first time. We also ask for your understanding. This is, by nature, a pilot program. Our goal at the end of our program is to see if our trend is reversing. If it works, we will ask to continue the program. If it doesn't, we will go back to the drawing board. This could be a pivotal moment in our community's battle against the virus, and with your help, it will. Jared?
Thank you, Mayor. I should have gone first. You said everything I was going to say. I don't have prepared remarks today. I would like to talk a little bit about what we've been going through over the last several weeks. We can go through all the data, and I've spoken with the media extensively about the data. What we do know is right now the amount of spread in the community is significant. We know you can get on all kinds of different websites and see data points that say where Quincy is, where Adams County is in the process, the likelihood you're exposed when you're out in the community. So ultimately, the goal remains to have people take measures to make sure that the virus does not spread, make sure that we are doing our parts in the community. From our end at the health department, we today, for instance, are reporting over 150 cases, and that number keeps growing. And so what we're experiencing, even though we've had a significant increase in our number of available workers, is that it is very difficult to stay up with the isolation and contact tracing and quarantining process. The exciting thing that's going on today is, while we know that as we start to do this testing process over the next 2 weeks, we will detect more disease and we will have more of this work, what the city of Quincy is doing and offering us, what the county government is stepping up to do, and I'm not going to leave short other volunteer agencies. We're working with Blessing Riemann. Quincy Medical Group has volunteered staff for this process. John Wood Community College, we have volunteers coming out all over to make this effort possible. And so we understand this is going to create a massive workload. We also understand, and we want the community to understand, we will find positives when we do this. There's no doubt that we will see numbers increase more. As a part of this project, the goal is, as those increase, as people realize that they are ill, that they are carrying the virus, they will be able to take proactive steps. What we do know, what we've seen in this entire effort is we have a community that wants to do the right things. We just don't always know with this virus that it's in us and spreading. So this effort is going to drive those numbers short term so that in the longer term effort, they're going to drop back down and we can get to a sustainable level. The other day, we were working with the hospital. When we're reporting capacity numbers like we're talking about in this community, this impacts everybody. We all know that not only do we get ill from COVID, we are entering flu season. We are starting to see flu. By the way, get your flu shot if you haven't yet. We're starting to see these diseases. We also know that all of these other health issues that drive people into the healthcare sector, into the hospital specifically, are ongoing. We have to have this capacity. And so, again, this is an effort that we understand is going to be monumental, but the goal of which is to decompress the pressure on the health system, to allow our community members to be more informed, and to make sure that as we get into the holiday seasons, we don't have the levels of disease spread that we're experiencing right now. So very, very pleased, very thankful that as the local public health department, we've got such amazing support from many different groups coming together to make an effort that we would have not thought possible a couple weeks ago come to light. I also want to thank very much the state health department. This project is pretty novel. It's something that we're looking forward to doing, and they're interested in getting our data back on it so that they can see if this is something that will work in other areas. So with that, I think John's going to kind of walk through the plan, what's going on with it, and the last statement I'll say is we'd like to see 20 to 30,000 tests done in the next 2 weeks. So we'll need the community's help to do that. John?
Thank you, Jared. You know, we've been planning for scenarios, maybe a little bit different, but somewhat like this for well over a decade, that we have the capacity to, and that planning has been in the vein of being able to provide mass vaccination should that be required. What makes this unique is we took those plans and we adjusted and modified them to be the response for our hour of need. As we continue to see these cases, as we continue to see and hear stories of people in our community that are being identified late in the process of being positive, The entire goal is to be able to rapidly identify those and get them into isolation sooner. We know our community rises to the occasion, and we also know that this will be no different. So beginning on Monday, our rapid testing will be available in the Shopco parking lot at 33rd and Broadway. This testing screening process will be a comprehensive process that takes in facets of not only the test, but begins the contact tracing process. As both the mayor and Jared indicated, this will be a very staff-intensive project. But by centralizing and collaborating our resources, we'll be able to do this through a one-stop shop, if you will. So beginning Monday at 10 a.m. To 7 p.m., we will start that. We will schedule this for at least a minimally of a 2-week period. Now, moving forward after Monday, the normal hours will be based on demand, but we look to have those extended from 10 beyond the 10 to 7 a.m. or 7 p.m. time frame. Again, we plan to do this for 2 weeks, for 7 days a week. The key is having access to testing, and so having access on Saturday and Sunday is essential for this program. The mayor alluded to this, but first and foremost, we ask for everyone's patience. If our intent is to test 20 to 30,000 people over the next 2 weeks, we can't do it in one day. Not everybody can come through the line in one day. What we ask is that for your patience, but if you're feeling ill, if you feel like you have the sniffles and it's, oh, that's just seasonal allergies, this is the opportunity for you to get tested so that you're not exposing your friends and your family and your coworkers, and you get a result within 20 minutes to at an hour at the most. But we're asking for patience as we go through that process. I'd like to outline what that process is going to look like. We ask people to enter the Shopco parking lot from the 33rd Street entrance. They're going to be There are intake forms that are available on the health department website. They'll also be available there when they arrive. If you show up with the completed form, you can proceed directly to the testing area and get in the queue. If you don't have that form completed, it's no worries. There's a parking area, a holding area. You complete that form, and then you proceed to the testing area. I want to talk about that intake form because that's really part of the novel part of this process. Is not only does it take the individual demographics of each person that's being tested, which is necessary for the test, but it's the beginning of the contact tracing. So it looks at what symptoms, if you are experiencing symptoms, what symptoms are you currently having, or have you resolved from those? Where have you been? Who have you been in contact with? So that is already captured at the time of the test. And contact tracers can begin that work immediately following the result. But again, that intake form is the first step. Once that's completed, you proceed to the testing area where we have firefighters, paramedics, EMTs, nurses, nursing students that are all working together in order to do those tests. It'll be in a drive-through. You won't even have to get out of your car. They'll reach in, take the swab, and start the test process. It takes approximately 15 minutes for the test to result, and at the conclusion of that test, we'll have a data management area that is recording those results and then making a phone call contact to your cell phone that's identified on that intake sheet, and you'll get those results, as I said, anywhere from 20 minutes and at the absolute latest, depending upon volume, at 1 hour. That contact tracer, when they call, they'll review certain bits of information. If you're positive on that form, they will provide with additional information and with resources to make sure that we're giving those that need that assistance, need direction on how to isolate from maybe their family members and how they can do that safely in their home. We'll also notify if it's a negative result so that you know that at this point in time you're negative. But it's important to note that just because you're negative right now doesn't mean that in another day or another two you didn't have an exposure that now something changed. So is it realistic that an individual may have multiple tests? It certainly is. And the key is having access to those tests. After you move through the tent structure that we've set up there, you'll be able to exit out on the west side of the Shopco parking lot and be on your way, and again, expect those results shortly thereafter. The mass drive-through is really the keystone of this project, but there are other components to the overall approach. First, it is having an employer-sponsored partnership where we are taking testers and contact tracers and we're going into businesses and we're making those tests available. Again, identifying those positives the quicker we can, get them out of the workplace, and begin that contact tracing. That program has been very successful. We've communicated with many of the business leaders and had a good uptake. If you are a business leader and are interested, reach out to the health department, reach out to the mayor's office, or reach out to the emergency management agency, and we will work with you to make sure that we can take advantage of those opportunities. Lastly is a mobile testing. In the days to come after we stand up the drive-through testing site, will be a mobile where we reach out to the communities, the villages across Adams County and into Brown County, essentially taking the exact same process that we're doing at Shopco, or the former Shopco building, I guess I should say, and getting that local in your communities. So that's the process. And now I'd like to introduce Ken Snyder, the chairman of the board.
Thank you, John. The situation with COVID continues to be serious in Adams County. You know, we got the disease, but we didn't get the playbook. We are today helping write the playbook. This was a monumental task that we're about to pull off next week, and it's a game changer. If it's successful, it's a game changer for the whole state. Everyone will follow our lead. So now is the time in our community that we need to get to do the right thing for each other, to protect our loved ones from our contagious disease. And I encourage everyone to go through the drive-through testing. This mass testing will help our community recover quicker, so we can get back to doing things that we love, like having Thanksgiving dinner with our loved ones. And I just want to let you all know that the mayor and myself, we live this disease 7 days a week. We don't take breaks. We don't take holidays. I personally haven't been out of town maybe twice in a year, and I know the mayor seldom gets out of town also. It's just turned into our life. So we're going to fight till we whip this thing. And in the meantime, we want everyone to be safe. We pray for you and your families. Thank you. Any questions?
For Jared, probably. Can you just kind of, now that we're obviously going to be testing a lot of people, kind of talk about, John noted a little bit of the process, kind of update people on what you do when you have a positive test, since we're going to be seeing a lot.
Sure. So through this process, with the immediacy of the results, the entire operation being in the locations that we're operating out of, they'll expect a call within an hour, positive or negative. When they get that call, if they're positive, the registration form is basically a base of their contact tracing. So it'll take them a little bit of time to fill that form out on the front end. We'll get it, and then we'll save them a half hour of conversation on the back end of it. And so we'll have their contacts. We'll review their contacts with them, make sure they're kind of thinking about things in the way that we need them to. And then they'll be instructed on how isolation goes, what their isolation end date is, how they can seek resources if they need them, how they can seek care if they need them. all within a very short amount of time. So one of the barriers we've had is as our cases have grown and grown, that case backlog has. So how is more testing going to help that? Because of the mobilization of a mass quantity of human resource to do this work for us. So that's been a great part of this process. And the mayor's declaration and the county's willingness and, a lot of volunteers coming out of the woodwork to help with this process is what makes this possible.
And we've spoke before about the long-term care facilities. Are we going to start using those rapid tests in those?
Yeah, we actually already have. That's what started this idea. What we've found is the long-term care facilities. It's a very difficult situation to keep disease out of there, and the higher the disease levels get in the community, the harder that is. So when we started to see outbreaks, right when this rapid test became available, we asked the state, and that was another area the Department of Public Health came through. They got us rapid tests as soon as they were available. We had some down here, and we were able to deploy them into nursing homes. And when they're in active outbreak situations, right now what we're recommending that they do is use these tests to test people before they come on shift. And that way, if they're a direct care provider and they're providing care to your elderly loved one in one of these homes, they are tested before they ever get into contact with them that day. We've seen it work. There's been asymptomatic individuals who would have otherwise worked a full shift in these places, and we've been able to detect that disease as active in them and make sure that that didn't happen. So it really is what generated the idea here. We have so many people who are walking around not with the knowledge that they have this. Nobody wants to give it to anybody else, but if you don't know, what are you going to do? So it really spawned this idea, and as we've seen this growth and this trend in the hospitalizations, we knew we have to think broadly. I mean, every effort that can be done needs to be thrown at this right now.
Jared, are you anticipating any more to receive any more rapid tests from the state? Since it seems like this whole plan is predicated on just enough tests being available. Yeah, they have committed to us initially 10,000, and as our quantities go down, when we hit a 35% usage, they'll deploy more to re-implement that for this full 2-week window.
Is there any other county in the state of Illinois that you know of that's doing this or planning to do this?
Not that I know of, no. There may be, but not that I'm aware of.
You kind of talked about yesterday, we're on this 2-week, backup right now. You said even if we didn't have any, we'd still kind of talk about a timeline maybe, like you said, it's going to get worse before it gets better.
Right. So what we know is it takes hospitalizations, death, those are lagging indicators. So where we are with daily numbers right now, in the next 2 to 3 week window, that's when we're going to see those in the hospital. So we've worked extensively with them to make sure that they are aware of the level of need that we're asking them to plan for, and they're making accommodations to do so. If we stop disease transmission today, we still have a couple weeks of challenge, and we know it's not stopping today. But the effort that we're doing over the next 2 weeks is what we're trying to do to get it to stop before we get into the cold flu season. And we know every year there's a lot of demand for hospital care with flu itself, and so we're trying to get a grasp on this thing before it gets any more down the road with hospitalizations than it is.
Is there a biggest threat in terms of location that is leading to the high cases, whether it be schools or families or funerals, weddings,
Sure.
anything like that?
Yeah, we have seen. I could say this broadly speaking. If you are a human right now, you have risk all over the whole globe. So we see this going on everywhere. That being said, there's in our community we've seen spread in about every area that you can think of. There's workplace spread. I will say, with schools themselves, we continue to have great success, and that leads to this whole thing. Our kids don't have any problem following the rules and doing the right thing for one another. That's the expectation. They do it. It's not spreading in that environment. There's proof in front of your eyes that this will work if we all take these steps. But it's in private gatherings, it's in public gatherings, it's really wherever you are. Right now, we should be trying to separate ourselves distance-wise from one another.
Thanks, guys.
Thank you.